there you are. Introduction. In terms of mental health, we say that it's about me, it's about I, it's about myself. Mental health definition. It is a state of well-being where a person can cope with normal stresses of life, work productively, and contribute meaningfully to society. Look at it. We have a mental health exercise. Let's do an activity. In this activity, I want you to get a piece of paper, press it on your head, draw your face, write your name, and note what you want to change. Yep. And you realize when you place that paper on your head, you will not believe that you ever went to any school because of the kind of writing that will be there. However, observe if the picture is deformed. This symbolizes self-perception and awareness. The next thing, what do we mean? When you look at that piece of paper, you realize that drawings are not very nice. It means it's only you who understands yourself. Get to know who you are. Don't allow people to describe you and to tell you who you are. The key message here, nobody else can understand you apart from yourself. Examples, it's not your parents who can understand you, not your employer, not your child, not your spouse, not even peers or friends. What do we see around the world? The global figures on mental health. Did you know out of every other 4 patients, or 5 of them, 1 out of 5 patients attending hospital suffers from stress. And we realize that in terms of gender difference, more women than men have mental health issues. What is it all about? The importance of mental health awareness. There are mainly domains. It is the importance of it. It helps us to go around ourselves spiritually, psychologically, emotionally, and socially. The benefits, positive mental health, and cross-examining ourselves determines our relationships, performance, improves memory, balanced life. It helps us in decision making and also self-image. It helps us to avoid lashing out when handling issues. Experiences affecting mental health. What really affects our well-being? Yep, let's check out the factors. There are quite a number of them. Factors that influence mental health, like today, child abuse, social isolation, discrimination and stigma, domestic violence, physical health issues, poverty, unemployment, bereavement, trauma, and imprisonment. Shockingly, today there are so many children who suffer abuse, not only just violation, even sexual abuse. What about discrimination and stigma? It happens. It can be out of disease. It can be out of poverty. It can be out of accommodation. Maybe somebody is even orphaned. Issues of health, you understand them more. So what do you do? And that is why we encourage you to talk about this or to seek counsel, because some of these mental health issues are causing people to end up abusing drugs, to engage in violence, others engage in very negative addictions, or even they end up fighting, killing, or even becoming suicidal, or they get hopeless. So what do you do next? How do you maintain health or your mental health? Questions to ask. Who am I? Know your identity and purpose. Also, where am I? Know your surrounding environment. Again, how is my current status? Where are you currently situated in life? Yes, and you are advised to do what we call, you practice self-care. Number 1 is therapy. And that is why Alalat is encouraging people to engage in therapy, engage in timely therapy or seeking counseling and conflict resolution. Number 2, positive leisure. Participate in positive leisure activities and group therapies. Then also you are advised to budget for personal needs and plan your life. Such things will be very critical in managing your mental health. We have stress management techniques. What do you do about this? Choose the most appropriate stress management technique for each situation. For instance, if you have a big test coming up as a student, or somewhere you are made to meet deadlines and you are feeling overwhelmed about that, you find it hard to concentrate. What do? In such a moment, you take a deep breath. You also know and get how to do time management. What about a scenario? You had a disagreement with a classmate or a close friend or a member of your family. You want to find a way to express your emotions and clear your mind. What do? You do journaling. Later, you can check on things like mediation or even social support. And then let us know there are areas of self-care. We have self-care is a time that you dedicate to yourself, because if you care about yourself, you'll be there intentional, and also you'll be boosting and nourishing your mental, emotional, and physical health. In the wheel of self-care, you will take care of your physical needs, psychological, emotional, spiritual well-being, and also personal needs like trust yourself, listen to music, unplug from technology, set short and long-term goals. What about your profession? You need to read a book, exit or sometimes keep on taking deep breaths. You can do a lot of even going out for what we call training on the job. Such things will help you in your profession, besides having a surrounding team members whom you are working with. So what can we see here? In terms of issues of mental health, please note depression and mental health challenges are true and real. Depression is real and can be a silent killer. Approach. What do you do about it? You must assess every situation you get into. And sometimes you're called upon to accept some things. You may not be able to change them. You might be going through a very hard time. You are only called to accept and to adjust, then align, and then process them. And in most cases, you are advised, don't dwell on the past. Encouragement is that peace and hope, also through faith and spirituality, works. And practices like prayer, for Christians, thanksgiving, sacred music, and seeking to do good. Others, you are called upon to talk out your issues, and more so let us embrace counseling. In counseling, it is not about motivational speaking, and where you are speak out, because when it gets to a point of a mental breakdown, such a person, a child, a man, a woman, an adult, or anyone, it means they are not able to make the right decisions, or their decision making is quite affected. So what do you do about this? You need somebody else who can help you, they can listen to you, they can perfect you, and they can guide you on steps to undertake so that you get to a better point, and also you reposition yourself to be able to move on. Depression does not just hit people who are weak, neither people who are there not knowing who they are. No, depression is real, and it hits any person in life. And this is where you get very low, and you are not able to be productive at all, and you get hopeless. Sorry, this time round we have had majority of our youth getting into hopelessness. Drug abuse is on the increase. Family conflicts and fights are on the increase. deaths by suicide, deaths through homicide and femicide. All these things are too many. Why? Let us seek counseling. Let us also consult. Here at Alalat, we do welcome you. You can call on this number where we have a team of people who have had a wealth of experience in many, many years. Not only that, they are professionals. They can handle your case very well. Our number is 0743 500 485. And we will attend to you in a great way. And there will be success in all that you'll be endeavoring to pursue. So we call upon you to look at the area of mental health. Wherever you are, wherever it is, look around and you see that you need something. We need that therapy. We need that counseling. And even some cases call for referrals, even to see people who are highly experienced in this area. But this you can go through guidance. So karibu sana, you are welcome, and keep on subscribing and checking on our channel. We have more and more for you, especially things to do with children and also general social life and the issues that are affecting us today. Thank you and welcome.